Kidney cancer, like most cancers, is the uncontrolled growth of abnormal tissue, obviously in this case in the kidney. There seem to be a lot of things that may lead one to have a higher risk of kidney cancer, but in the vast majority of cases, it is not based on family history, it's not based on diet, activity, or any other factors that are under the patient's control.
Every time a single cell in your body divides, the enzymes that synthesize your DNA make 120,000 mistakes. Some of these mistakes wind up being beneficial. Some of these mistakes wind up being harmful, and some are just neutral. They don't make a difference. But if a mistake, a mutation in a cell's DNA, causes the cell to behave abnormally and stimulate its own growth, ignore signals to stop, stimulate the body to give it its own blood supply, potentially multiply forever, and unstick from where it began to spread throughout the body, it becomes a special type of cell. We have found 200 diseases with various origins and natures that fit this description. Despite being different, they often go by the same name: cancer.
Doctor, could you tell us what are the kidney problems that people need to be aware of? And how could people suspect they have them? Are there any signs and symptoms that people need to be aware about?
Kidney disease sometimes can come without any presenting signs and symptoms unless and until it is very advanced in stage, at which time the patient can present with symptoms related to the buildup of all the waste materials in the body. This can lead to symptoms like lack of concentration, generalized fatigue, feeling very weak, no appetite, nausea, vomiting, increased itching all over the body. And in addition, because your kidneys play an important role in removing the excess salt and water from your body, the patients can present with symptoms like swelling. This can be noticed either over the feet, the legs, or it could be puffiness of the face, tightness of the hands. And if the fluid tends to start getting built up in the lungs, then the patient can have symptoms of breathlessness because of the volume overload.
So it's true, we haven't found one cure for cancer yet, but that's kind of a question wrongly asked. There is no cancer to cure. There are lots of cancers we need to cure. Advances in things like DNA sequencing mean that even though there are as many cancers as there are cancer patients, soon there may be as many cancer treatments as there are cancers. And that's pretty good news.
Many cancers are already cured. There are many people with cancer who have got rid of their disease and will live a normal life expectancy. But a cure for cancer in its totality, in all its forms, is likely to be a long time coming. It's a very complicated disease. What we are likely to have in the near future is treatment which will stabilize the cancer, which won't make it go away, but which will make it into a chronic illness, which is there, but as provided you take the treatment, it's not bothering you, just like diabetes, high blood pressure, angina, which are treated to control rather than eliminate the disease.